I'm Rick Buck, and I've been a dentist for 17 years. In this video, we show and explain the best oral hygiene routine that decimates plaque, thus reducing gum disease, cavities, and bad breath. It also increases your chances for long-lasting good breath, whitens your teeth, possibly reverses small cavities, and minimizes the chances of damage to your teeth as other thorough brushing routines might do. Let me start my routine by staining all the plaque in my mouth pink, which will give you a baseline so you can see at the end how much of it has been removed. Step 1, tongue scraping. You will see how it easily removes all the buildup around the tongue scraper blades. The tongue is the biggest reservoir of bacteria to resupply your mouth each day with more bacteria. Cleaning the tongue heavily reduces that reservoir of plaque, so you have less daily buildup. Tongue scraping also has been shown in studies that it will give you longer lasting good breath and is the main source of bad breath. While other measures will improve your breath, tongue scraping has a longer lasting effect. The further back on your tongue you scrape, the better the results will be. I try and scrape one half of the tongue at a time, so if your tongue curls up due to triggering of the gag reflex, it will still clean that side well. So quickly, here's my tongue scraper working when my plaque isn't stained pink too. The type of tongue scraper helps a lot with this process. Most of the products I prefer are my own products, and I will explain why throughout. This tongue scraper has 2 blades. Like razors that use multiple blades for shaving, each stroke with the 2-bladed scraper will remove more plaque and miss less plaque. This tongue scraper is also long, so it will get further back on the tongue. My tongue scraper is not wide like a lot of the popular tongue scrapers that supposedly will do it in one swipe, because that one swipe will miss a lot. Step 2, floss. Now, as I floss, you can see how much plaque my floss removes as it bunches up against my tooth. The flossing step is probably the most important for preventing gum disease and cavities. Flossing removes plaque between the teeth that is most responsible for gum disease and tooth decay. You should watch all my videos on how to properly floss, but here is the gist of those videos. Snap the floss between each gap and rub the floss up and down on the back tooth of the gap. Do that a few times, and then the front tooth of the gap a few times. Then snap the floss back out. The floss should make as much of a C shape as possible during the rubbing motion. People often wonder if they should floss before or after brushing, or if it's even important. Before brushing is better. Flossing first enhances plaque removal because floss removes the plaque colonies as all one unit. If you brush first, the brush breaks up the plaque colony into pieces, which makes flossing more spotty. Now, if you floss first, with the plaque between the teeth gone, any rinse or toothpaste that you use during the rest of your brushing routine will work better because the plaque will not be there to impede the flow of the rinse between the teeth, and any fluoride will act directly with the teeth and it won't be blocked by the plaque. Over time, flossing also conditions the gums so they are strengthened and bleed less. The Ezzy Expanding Dental Floss is the best floss for most people. It removes more plaque because it tightens to snap between the teeth, then flattens and expands to increase the surface area. This larger surface area removes more plaque. It also has xylitol and charcoal in it. Xylitol is antibacterial to inhibit plaque reformation. Charcoal also is antibacterial. It is black, so you can see what you remove when you are flossing. Sometimes people will complain about this floss because it will shred, but this shredding happens because it catches on unsmooth fillings with small overhangs. Well, this isn't the floss's fault, this is the filling's fault. In fact, this is likely where plaque is building up to cause more decay under the filling. Instead of giving up on the floss, a better route would be to have your dentist smooth out these old fillings. If you use a less effective floss, it may feel smoother, but it's likely missing the spots where the good floss shreds. Okay, another factor that people think is a downside of the floss, which is actually a good thing, is that using this floss may also cause more bleeding and sore gums temporarily. Over time, you should see a lot less. You can see how much plaque removal we have done just with flossing properly with a good floss. Bad flosses won't do this good. Step 3. Rinse with peroxide. Peroxide kills a lot of the bacteria in your mouth, which will help to improve your gingivitis or gum disease if you have it. It also gives you better breath because it kills a majority of the bad bacteria that cause bad breath. It also is much more difficult for bacteria to recolonize when you decimate the baseline levels of plaque. I use a 3% peroxide because it has a pH around 6, which means it keeps or raises the pH in your mouth above the cavity forming pH called the critical pH. The critical pH is somewhere from 4.5 to 5.5. Many other rinses have a pH below the critical pH. Peroxide is also a teeth whitener. A lot of mouth rinses and toothpaste will stain your teeth and darken them over time. While the peroxide rinse won't be on your teeth long enough to whiten much, it is still much better than most other antibacterial rinses and some toothpastes that stain your teeth a little bit darker. Watch all my videos on teeth whitening if you want to know more about peroxide and whitening. I personally take a shower, and then after the shower, I finish the rest of my oral hygiene routine. As I explained earlier, I do the peroxide rinse after flossing and tongue scraping to get rid of most of the inhibiting plaque barriers first. However, you can use the 1.5% peroxide called Peroxyl. It is nice because it leaves a good scent to it as well, and it has a favorable taste to it. Step 4. Brush teeth with Act Rinse, not toothpaste. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. Now for my favorite dental care product. My Ezzy electric toothbrush blows all the other electric toothbrushes away in its cleaning ability. The brush head bristle design cleans further between the teeth much better than other brushes. Most brushes clean exposed surfaces of the teeth well, but the best toothbrushes like Ezzy clean far between the teeth. This brush head has much more power than the more mainstream brushes, so that each vibration of the brush head has a much wider stroke, all the while maintaining the same amount of strokes per minute. It has a lot of other great features, but those are the most important features for the cleanliness of your teeth and why I recommend it. To brush properly, make sure you do the following. First, ensure you aren't brushing right after a meal. That is when the tooth is weakest and will wear away more easily to brushing. It is best to wait at least 20 to 30 minutes to brush your teeth after eating. Second, use an electric toothbrush because it will help ensure you brush the full 2 minutes and with light pressure as well. People tend to brush with almost half the force when brushing with an electric brush. And brushing with too much force is the main cause of abrasion, followed by brushing right after a meal and then using abrasive toothpastes. Third, aim the brush 45 degrees to aid in the bristles getting under the gum level. Use a circular motion while brushing, especially don't brush with a back and forth motion because you're more likely to put a ton of pressure if you do it that way. Back and forth strokes cause more pressure and thus more gum recession and tooth wear. In my routine, you've noticed we brush after almost everything else because the brush just does the cleanup work of the leftover plaque. And as you can see from my other videos, and we'll see in one moment, brushing after removes more plaque overall. Brushing after flossing with an electric toothbrush will also better propel the fluoride rinse between the teeth without plaque layer that would block the fluoride, as I've kind of already explained. Now, the rinse in this step will normally leave a great short-term minty fresh breath, so you'll get it from that instead of the toothpaste. However, brushing when done incorrectly can cause gum recession, tooth wear, and these little notches in your teeth. These are the most common problems I see for people that think they are taking good care of their teeth. I personally don't use toothpaste when I brush my teeth. I either brush with Act Rinse, peroxide, or sometimes just water. Here's why. Toothpaste and brushing with too much force are the biggest culprits for causing gum recession. and it's associated also with tooth wear. Toothpaste, especially some whitening toothpaste, can be very abrasive, which is why I don't use them. You can see from this list of how abrasive toothpastes are. Rinses, on the other hand, are almost not abrasive at all. Watch my video on why toothpastes are pointless in comparison to rinses for more on this, but here's the gist of the reasons from that video. Toothpastes, as shown in this study, have been shown to reduce plaque removal when brushing. That's right, a little less effective to remove your plaque when using toothpaste. So your teeth possibly get less clean when you're using a toothpaste as opposed to brushing without it. It is minimal, but still it's less clean. This study shows a lifetime of brushing without toothpaste is unlikely to cause tooth abrasion that toothpastes can cause. Lastly, many toothpastes use SLS, or sodium lauryl sulfate, to make it feel bubbly and good when you're brushing. But a lot of people have reactions to SLS. Act Rinse is SLS free. In fact, Act Rinse provides a high immediate boost of sodium fluoride and has a pH of 7 to 7.6, which will boost the pH of your mouth above the critical pH. Sodium fluoride strengthens the tooth to prevent decay and in some cases possibly reverse cavities. Because it's in a liquid form, it also moves more freely between the teeth to strengthen with fluoride between the teeth. Watch my video on reversing cavities to know when and how this is possible if you want to try and reverse them. Now, the high pH of Act Rinse means less acidity, making it difficult for bad bacteria that cause cavities to flourish, and less demineralization of your teeth as well. This is what also could possibly stop the process of decay. And so that is why I love brushing with Act Rinse, or possibly even another rinse. It uses sodium fluoride to provide the fluoride. It doesn't use stannous fluoride, which tends to stain teeth more, even though stannous fluoride is better for preventing gum disease than sodium fluoride. But the peroxide from the peroxide rinse is better than stannous fluoride for preventing gum disease. So we have covered all our bases earlier. Stannous fluoride is also better for anti-tooth sensitivity, but if you have sensitive teeth, then you can use Sensodyne Rinse, which uses potassium nitrate to reduce sensitivity. The only problem with the Sensodyne Rinse is that it's hard to find in the US sometimes. Also, it uses sodium fluoride and has a pH around 6, so it's great too. So as you can see with my final results, this is how I get my mouth almost spotless each day, almost eliminating the risk of gum disease and cavities, but also having really fresh breath and white teeth. I mean, this is really clean. Now, a few other notes for optimal dental health. Less meals, intermittent fasting. After brushing, I highly recommend eliminating snacking or implementing intermittent fasting. The reason why is eating meals lowers the pH in your mouth, putting it at risk of cavities. Your saliva buffers that acidity in time into the safe zone that won't cause cavities. However, the more you snack and the more time your mouth is in an acidic state, the more likely you are to get gum disease and cavities. No refined sugars. Studies have shown that cavities are caused by sugar. The more sugar you eat, the more your mouth lets cavities and gum disease causing bacteria flourish and survive. Intermittent fasting and reducing sugar, and really any processed carbohydrates as well, lead to fewer cavities, less gum disease, and a myriad of other health benefits not even related to the mouth. Reversing cavities. The possibility of reversing cavities decreases the bigger the cavity gets. My routine is sufficient for maintaining a healthy mouth. However, if you want the possibility of reversing cavities, it takes extra attention. You have to give up refined sugars and stop snacking. You should carry floss and a brush around with you everywhere you go, and do a quick floss and toothbrushing 30 minutes after every meal. That's if you are trying to reverse cavities. Then I would either switch with Act Rinse or choose sugar-free gum that has xylitol listed as the first ingredient. This is all in addition to the regimen I have already given that you would need to do both morning and night. As you can see, it is difficult but possible to reverse some cavities if they're small enough. On a side note, if you are trying to reverse cavities, I wouldn't assume that you're reversing them. You'll need to do a follow-up with x-rays with your dentist to see their status. But if they aren't reversing, they are getting bigger and would have worse effects like root canals and extractions. So If a dentist tells you you need a filling, you should go have that filling done. But if you're someone that's prone to just having a lot of cavities, or if they're really small, what we call incipient caries, and they could possibly be reversed, this is the regimen that you would want to follow to do that. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. If you're a dentist with a digital scanner, my brother's incredible dental lab is in the description, and he can work with you anywhere inside the United States. Like and subscribe to my channel if you have teeth.